Welcome everybody to NHS Barnsley Clinical Commissioning Group. My name is Chris Millington, a governing body member. I'd like to welcome our guests, Carrie Abbott, who is representing Barnsley Council, and I was going to announce and say thank you for coming to Nick Joanne, but I haven't seen him on board yet.
Yeah, I have joined the call. I'm here.
Okay, welcome. Our meeting today, which we're holding in public, is the Primary Care Commissioning Committee, and it's my task today to chair this meeting, which I anticipate will take just over 1 hour. We've actually set 1.5 hours aside. Our agenda today runs to over 150 pages of information, all for assurance, some for information, and some for approval. I apologise in advance to members of the public because, as in any organisation, we use jargon words. You will hear ICS, which stands for Integrated Care System, or PCN. This is our primary care network, where all of our 33 practices have come together in a geographical group across our borough to deliver new ways of working. Our meeting today is being recorded to enable members of the public to watch what we do as commissioners, how we arrange and look after the people of Barnsley. And you will also hear about our executive teams who work in the background, liaising on a day-by-day basis with our providers. Our providers of care are our local hospitals, Yorkshire Ambulance Services, the hospice, and lots more people who go out into the community supporting people in their own homes. As commissioners, we buy and pay for health services for the people of Barnsley. We also pay for medicines as and when required. As we progress through our agenda, some of this will come together in the form of how we are arranging and delivering care in the community. I will shortly ask the committee members to very briefly introduce themselves, and I'll call out names. Because of some of the complexity of our committee papers, our head of primary care, Julie Frampton, will condense and summarise the papers at agenda item 10, which is the contractual issue report. As if you were able to see all of the papers, there are 26 pages of A4 information behind the presentation that Julie will go through. All of the papers have already been sent to the committee members to enable them to ask or pose questions today for their own assurance and to confirm that we are in fact delivering value for money. We hope you find our meeting informative and helpful. So to introductions, I'll start with Nigel Bell.
Hi, Nigel Bell, I'm the lay member for governance at Barnsley CCG.
Thank you. Mike Sims.
Secondary care specialist on the governing body of the CCG.
And Richard Walker.
Yeah, I'm the head of governance and assurance for the CCG, and I'm a member of this committee.
And for the members of the public, those 4 people are in fact voting members. On to our clinical advisors, Dr. Gunter Muckler.
Madhvi Gunter-Muckler, GP and Medical Director for Barnsley CCG.
Mark Smith. You're muted, Mike. Mark, sorry.
Sorry, chairing body member. Is it still muted? Sorry, can you hear me?
Yes, we can. Yes. Our chair of the
GP and governing body members.
Our chair of the CCG, Nick Ballack. Where is our Nick?
Dr. Nick Ballach, GP and chair of Barnsley CCG.
Thank you, Nick. And In attendance, we've got Julie Frampton.
Morning, I'm Julie Frampton. I'm Head of Primary Care at Barnsley CCG.
Our VIP member, Angela Musgrave, who works tirelessly in the background to put all this together for us and records every single word that we say. It's a Herculean task. So, Angela.
Good morning, everybody. Angela Musgrave, personal assistant at Barnsley CCG.
Nick Germain from NHS England.
Yeah, Nick Germain, primary care manager with the South Yorkshire and Bassett Law team in NHS England.
And Carrie Abbott, who is representing Barnsley Council. Carrie.
Yeah, thanks, Chris. Yeah, Carrie Abbott, Service Director for Public Health and Regulation at Barnsley Council, deputising for Julia Burrows, the Director of Public Health. Thank you.
Thank you. Ruth Sims.
Finance Manager Ruth Sims at Barnsley CCG, covering primary care.
Thank you. And finally, Roxanne Naylor.
I'm Roxanne Naylor, Chief Finance Officer at Barnsley CCG.
Okay, so that's the introductions. That's everybody who was on the committee this morning.
Sorry, Chair, you've just missed me.
Oh,
it always happens to me. So I introduced myself. I'm Chris Edwards, the Accountable Officer for Barnsley CCG. Good morning, everybody.
It was a test, really. Chris, apologies for that. So, on to the agenda then, and item 1 is housekeeping. Now, bear in mind that you're all working from home or from an office somewhere. You can hopefully rest assured there are going to be no fire alarms. If they are, you know what to do and where to go. Angela, have we any apologies?
No, we've no apologies for the public meeting.
Okay, thank you. And we are quorate, yes?
Yes.
Thank you. On to item 4 then, declaration of interest relevant to this agenda. We have declarations of interest already printed and published, but are there any changes to today in relation to this agenda? Okay, I'll take that as a no. So on to item 5, which are the minutes of the meeting we held on the 28th of January. I'm looking for accuracy. Is this a true record of what we actually said and did? Happy to accept minor amendments. And then if we can progress through that, then I'm going to ask that we actually adopt these minutes. So first and foremost, is this an accurate and true record of our meeting? Dr. Elash?
Sorry, mine would be on the text of the meeting. So bottom of page 7, it talks about strategic primary care group, primary care operational group, and primary care forum. So it's just an error. The primary care operational group is the primary care forum. So there are 2 groups, not 3.
Okay, thank you for that clarification.
So that needs change. And then on page 8, let me just get to that. There's something there. And it's just a note that subsequent to that, the workforce risk went to governing body and people are working on updating that risk in terms of its wording and new developments. The risk around workforce 1410 was set up well before PCNs. So the impact of the PCNs, so you've got things in there like sustainability of practices, practice viability. It's probably not dependent upon the additional roles. It's what we expect to achieve from those additional roles that will be dependent on it. So that just needs, that's just a comment, and I think that went to governing body as well, Richard, and we're working on that.
Yeah, that's correct. It was a point I think you raised, wasn't it, at governing body, and I've had a conversation with Julie Frampton subsequently, and Julie's going to take those thoughts on board and have a look at that when she next reviews that risk. So we might have a proposal to make some amendments for the next meeting of this committee.
Yeah, thank you.
Okay, Nick, thank you. Take your hand down. Julie.
Yes, page 6. The committee was asked. The committee approved the sale and lease back application for Huddersfield Road. It wasn't a consideration; it was an approval. So can we just remove considered?
All right.
Thank you.
Okay, so those minor amendments will be sorted. And thank you for the detail there. Thanks very much indeed. So are we happy as a committee to adopt these minutes now with those minor amendments? Yes, okay, thank you. Okay, on to agenda item 6 then, which is the matters arising. 200110, we reviewed our terms of reference and that is now complete. 200110, the workforce risk review, which Dr. Milash has already touched on a few moments ago, and I believe Julie will probably be covering some of that at agenda item 10. And matters brought forward, 200707 is the GP survey, which again Julie will be covering at agenda item 10 when we get to there. So thank you again for the attention to detail on matters arising. I do love and always look forward to a complete, but nevertheless some of those have had to hang around for a short time, particularly the GP survey, because it's taken an awful lot of effort and time from our primary care team to actually dissect that, but I'm sure Julie will cover that when we get to it. So we have nothing on strategic planning, item 7, so on to item 8, which is Ruth Sims. Ruth, if you're ready.
Thanks, Chair. So I assume the committee has read the report. In this month's report, there's very little detail as we've received no further allocations. The underspend at month 10 is up 870,000, of which the variance on additional roles is the biggest contributor. At month 11, the variance for additional roles increases to 797,000. Ongoing discussions are taking place with the PCN to fully utilise the 21-22 allocation. In terms of the other variances driving the position in Appendix A, I'll just highlight some of the points. So there's a variance on other GP services for 144,000, of which the majority are due to the reduction in telephone costs this financial year. There's a further variance on premises cost reimbursement, but it's an overspend of 185,000, and this is due to a backdated CHP lift building management fees, and they're backdated to 2015-16. And then further to this, another variance that you'll see on the report is the Quaff Variance, which is the quality outcomes framework. Practices have certain achievements to make, and achievement is paid after year end, and Quaff aspiration payments are paid during the year. The variance on this is 174,000 underspend due to the aspiration payments in this financial year being lower than expected. And I'll open it up to the committee for any further questions.
Well, thank you, Ruth. Thank you for explaining the Quaff, which members of the public would probably not have the faintest idea what was all that about. So, committee, any questions for Ruth on this report? Nick.
Thanks. Yeah, I just had a quick question on Quaff, and it's probably my learning around it. But for the Quaff aspiration, because income was protected 1920,
yeah, exactly.
2021. Wasn't sure why the aspiration was actuals were lower than expected.
With regards to the aspiration, we did pay on protection, so the payments are in line with the guidance that we were provided with, but they're still showing as an underspend. They are in line with last financial year, and the protection was given to the practices.
Are you happy with that, Nick?
Yeah, thanks.
Okay. Roxanne.
Yeah, sorry, I just wanted to add to that. The reason would have been because we would have added a set percentage of growth in our budgets, which obviously when we received the guidance, that growth would have been slightly lower than what we anticipated. So again, that would be a contributing factor. So I can confirm that, you know, income has been guaranteed at the 1920 levels in line with the guidance.
Yeah, that makes sense. Thank you.
Okay. Dr. Balash.
Yeah, I think we're guaranteed at the 1920 levels, which primary care accepted because we were working on dealing with the COVID pandemic. However, I just wonder if perhaps we should have not paid on retrospective levels, but proportioned out, because this means that there is money that's not gone to practices, yet they were working 100% full on dealing with COVID and now dealing with COVID vaccination. So I think Nick's point is a good one. I accept Roxana's comment about the predicted growth, but I still think we should have maximised that, because now it doesn't go to primary care. Something to think about for the future if we ever have another situation like this.
I think it's probably just worth noting that the primary care co-commissioning budget is above the CCG allocation for co-commissioning contracts. So we are maximising the co-commissioning allocation received. We're just not required to fund as much as needed from the programme part of the CCG budget. So I think it's probably worth noting that part as well in that context. So we have guaranteed income in terms of the full CCG co-commissioning allocation. It's just what's funded again from the other parts of CCG funds.
Yeah. Nevertheless, I mean, we'll probably have a little chat outside as we go forward. I think any underspends in primary care need to be carefully thought through during the year so that we can maximise investment and capacity in primary care. So what I'm hearing is this might be a bit of a technicality, which is fine, but I, as a GP, don't like to see any underspends in primary care if there's a potential to get some increased outcome. And that's, I think, what going forward will be part of the work of the primary care strategic group with the support of Ruth. So thanks for that explanation, Roxana. Thank you, Chris.
Okay. Chris, as accountable officer, are you comfortable and happy with some of the comments you heard?
Yeah, I think Roxana summed it up really well. Is that and to be fair, these underspends are unfortunate and they are happening in other areas as well. It's the nature of the way the funding's come down to general practice, and obviously the position we're in an unusual situation, which has led to planning being slightly different this year. So yeah, I'm assured that that's fine.
Okay. Any more questions around this finance report from anyone? No? Okay. So on to agenda item 9 then, and this is for assurance from the CQC update report from Julie Frampton.
Thank you. So the Care Quality Commission, or CQC, is the regulatory body that reviews all practices and other providers to make sure that there is safe practice and quality standards are maintained. During COVID, this has been reduced down to reduce some of the burden on practices. During the last period, we've had 3 of our practices that have been contacted by the CQC, and the CQC are quite happy with how those practices are working and performing, and there have been no further actions deemed necessary at this stage. We haven't been informed of any other practices as yet that are being approached for their review. However, in the last week, the CQC have published a revised method of regulatory assessments, so we will update accordingly once we've worked that through to be able to present for the next committee meeting.
Julie, can I ask, has that gone out to GP practices as part of the weekly
Yeah.
update. Okay. Any questions for Julie on CQC? No, I'll take it that you're all assured on that then. So on to agenda item 10, which is contractual issues report. Julie, I'd like if as you go through these, if we can come to some sort of consensus rather than going back all over them again once you get right to the end of the presentation. So over to you. As I've already said, from there are 26 pages of information behind this. So Julie, over to you. Thank you.
Okay. So the first item to look at is the in-year contract variation. It came to our attention that Hoyland Medical Practice hadn't informed NHS England and ourselves of partners that had left the practice back in July and October 2019. So now that this has come to light, we are just bringing this to your attention to say that we have gone back over this and done all the due diligence and work with the practice to remind them of the process for partners moving on and leaving the practice. So this is just here for information. There isn't any contractual requirement in due of contract variations. So this is just here for the committee to note.
Okay, Julie, I think the committee have duly noted that, so thank you. Next.
So the next one here is for the committee to ratify a decision that was made with regard to extended access and the out of hours contract extensions. This was discussed at a virtual meeting of voting committee members. So this was to approve an extension for 1 year for both of these contracts. The history behind this is that we were awaiting for a national spec for the extended access that from NHS England. That will not be ready currently, so we have asked for a contract extension for both of those contracts, and this is something that the Primary Care Strategy Group will be looking at in preparation for 2022 onwards. So this is just here for the committee to ratify that virtual decision.
Okay. In relation to this item, then the voting members, are you all happy that to ratify this at this stage? Richard, are we okay doing that?
Yes, we can do that. You know, for the minutes, as I think Julie explained, it was the voting members only that sort of approved this extension. So we managed any conflicts of interest outside this meeting effectively. So so yeah, we're okay just to ratify here.
Okay. Any dissenters? No. Thank you.
Thank you.
Okay.
So the next item is Dr. Mellor and Partners practice sale and return. So the committee may recall we had another request from a practice to do this. We followed exactly the same process with Dr. Mellor's practice, have gone through exactly the same due diligence process, and we are assured that everything in there is in place to make sure that provision is there for the future. And the request of the committee is to approve the application for the sale and lease back.
Okay. Voting members, are you happy to approve this? Yes. Everybody happy? Yes. Thank you. All right, Julie, if you'd like to move on to item 4.
So item 4 is the GP survey, which Chris has already said is quite a lengthy document attached as an appendix. There are quite a number of themes that are recurring through here, and we have looked into this. We haven't really taken our sort of analysis further forward, and that's really been due to the COVID situation that we found ourselves in, and we didn't really want to place additional burden in primary care when the practices were already very, very busy trying to deal with what they needed to do as the pandemic response. So I'm hoping that you've all read most of the information, or all of the information. I just wanted to bring your attention to some of the questions and responses that we are probably going to target and are actually looking at targeting currently. Most of that is around sort of telephone access that patients are saying is very difficult. So that is something we are looking at and picking up through CCG and working with providers to have a look how we can improve telephony so that hopefully patients can access their surgery more effectively. We're also looking at how generally access can be improved. I think our access has been affected a little bit by the pandemic. You know, we've had people who are reluctant to sort of have face-to-face, and there were guidance that we needed to follow, and we've also set up a number of clinics that people with COVID symptoms could have gone and had face-to-face appointments. So we have tried to address some of these access things. We are looking to incorporate that more in with the quality dashboard, as quite a lot of the questions on here are replicated in the dashboard. And now that we have reinstated the primary care quality improvement group, Dr. Gunter Muckler and the team will be looking at these sort of things and moving some of these elements further forward. So that's a very quick whistle stop of a very long report, but I think in general we do benchmark quite well with peers and also sort of nationally, apart from the questions that we've sort of highlighted in the report where we are below, and they are the areas that we will target. So that's a very brief overview of that paper.
Julie, can I just stop you for a few moments?
Yeah.
And Dr. Gunter Muckler, as you know, over many different committees, we've gathered lots and lots of data, and we are all anxious now that this data isn't wasted, that we actually use it. So would I be right in saying that, in fact, the amount of work that the team have done on this in dissecting this survey will in fact give you an awful lot of thought and assistance to be able to do something? And I suppose the thing is, well, you've got it, so what? But we don't want to, so what? And I know for definite you don't want to, so what? So any just slight comments there as to what you hope to achieve from this?
Yeah. So I've had conversations with Terry Haig, because I know the dashboard has been on hold. So we are sort of reframing that for primary care dashboard and some of this information which we have got from the survey, but also I think if we go through the paper, interestingly, there's findings about how many face-to-face appointments, how many appointments in total have been offered. And I think if we look at the numbers, it's quite phenomenal, isn't it, really? Yeah, and I think to put that into the context of the survey itself, the sort of issues as to how many people are actually taking part in the survey and the statistical significance. So there might be customers out there who are actually happy, but I suppose when it comes to the survey, it might be the ones who are a little bit disgruntled might be coming forward more than the others are. So I think what I am working with Terry, and like Julie mentioned, there's also a bit of a thing about telephony, which I think there are plans in place to see how we can improve the access from the telephone line system itself, which will make a huge difference to sort of how calls are coming into the practice and how they are taken over. Yeah, so there is a piece of work that's going on, Chris, and all this information will obviously be taken into account.
Great, many thanks. Okay, Julie, where are you now? Is that you complete, or any more information you'd like to
So in terms of the GP survey, I think that's it. I don't intend to go through reams and reams of the report. It is quite lengthy, but I think both Dr. Gonta-Mukula and myself have sort of given our assurance that we will look at this and use it within the forums and help us to plan sort of next steps with some good evidence behind us.
Okay, so any questions for Julie on agenda item 10, other than what we've already touched on? No. Okay. So Julie, on to agenda item 11.
There are still some more items on the contractual issues, Chris. Can we work through those?
Hang on, sorry, beg your pardon. Yes, we've got the EDEC submission and the primary care policy and guidance manual, haven't we?
Yeah. So the e-declaration update, every year all general practices are required to submit their e-declaration. This year there's been quite a lengthy period of time for practices to be able to submit their EDEC. Normally it's a very short period of time. It usually opens early December and closes the towards the end of January. This year there have been 2 extensions to that. And unfortunately, despite all of that, we still had 5 practices that hadn't submitted their e-declaration. So we have had some liaison with NHS Digital, who reopened the portal, and I am really happy to say that now every single one of our practices has submitted their e-declaration. So when I wrote the report, there were still 3, I think it was, practices that were outstanding, but I have actually had it confirmed that every single practice has now submitted that. So which is really good news, because it means that the practices haven't breached their contractual obligations, and neither has the CCG breached its statutory obligations. So that's really good news for us. And so it's just really to update that we've moved on a little bit from the report and that we are actually compliant as a CCG. So it's just to note that for committee.
Julie, let me stop you. Can I bring in Nick Germain, please?
Yeah.
Hello, Nick. Again, would this fall within your remit, or it's good to hear the news that Julie's delivered this morning, but are you assured by that, even though it may not come into your direct domain?
Yeah, absolutely. Yeah, it reflects the work that Julie and the team have done to follow it up. I think we had a call yesterday, and there was, I think, 98% completion across the country, and there's 130 still outstanding at that point. So the fact that you've got all 100% done is better than some other areas that are going to have to follow these outstanding ones up. So it's we're assured.
Okay, Nick, thank you for that additional assurance. So, Julie, if you'd like to complete the final bit on the policy and guidance manual.
Yeah. So earlier this year, there was another update to the policy and guidance manual, which reflects some of the changes that have occurred over the previous year. So what we've done is done a quick summary of all of the points that have changed in the policy guidance manual, and we have listed them in the report here for the committee members to note. We will make sure that this is reflected in our reporting and make sure that we adhere to these new some of this is subtle nuance and some of this is changes, some of it is reordering within the policy guidance manual, but as a team we will make sure that this is used fully. I haven't included a link to the entire policy guidance manual, and neither did I include it because it is hundreds of pages long. So I just felt that it would be pertinent to bring up the changes for the committee to note, and ask the committee just again to note that there are some updates to that policy and guidance manual.
Okay, so just to summarise then, we've talked about the sale and lease back of Garland House. We've noted the GP survey analysis, which is complete. We've had an update regarding the completion of DEC submissions, and we're asked to note the summary provided in relation to the update of the primary medical care policy guidance manual. So is everyone happy that we have done what we needed to do under the items at agenda 10? Okay.
Yeah.
Let's move on then, please, to item 11, which is clinical systems bridging agreement. And
yeah.
Julie.
Yeah. So NHS England's procurement team have looked at putting in bridging agreements for the supply of the System 1 and EMIS clinical systems, which the majority of our practice is using in Barnsley. So I've put in a brief summary of what these call-off agreements are and what the bridging agreement is. And this has come about with the demise of GP SOC and the the startup of GPIT Futures. Because of the pandemic, quite a lot of the frameworks haven't been fully developed, so therefore we couldn't run a full procurement process. So this has enabled the provision of the clinical systems to be in place for the next 18 months, which gives everybody time to look at the further procurement of clinical systems when that framework is finally published. So I have taken this to SMT, CCG's SMT, and gone through that in detail. I have spoken to Roxana as the Chief Finance Officer around this, so she's aware of this process too, and it's been brought to the committee for you to approve. And I appreciate that it's quite short notice, but this was done quite late on with NHS procurement team. So in order to make sure that our GPs have their clinical systems for their work, the ask is for the committee to approve the call-off forms for these systems.
Julie, as you know, there's an awful lot of background information there.
Yeah.
I'd like to call in Nick Germain, if I may. Nick, how much of this have you been involved in? And it's not so much shall we, shan't we, but it's almost mandated, this, isn't it?
Yeah, and I think our local South Yorkshire team have been cited on it, but it's been a national procurement. I think the lots, and is that right, Julie?
Yeah, it's a national procurement, but it's down. It is for each CCG to approve, even though it's being done through that national procurement system.
Okay. Any questions from our clinical advisors on this? No. Okay. Well, I've got to ask the voting members if, in fact, they're happy to approve the call-off order forms for GP IT Solutions. The appendices are the bridging agreement, the EMIS bridging agreement, advice and guidance bridging agreement, and the DocMan for vision bridging agreement. So is everyone content that you want to come back in?
Yeah, I was only to say the only thing I'd add is that the bridging agreements are going to each primary care commissioning committee, so it is in this sort of time scale because of when these have been required. So it's something that every PCCC is having to approve. Yeah, so it's not unique to Barnsley.
Okay.
Sorry to chip in.
Okay, no problem. So can we take that as read and approved? Yes.
Yeah.
Okay. Thank you. Okay. On to item 12 then, the 360 assurance report. And would you believe it's someone called Julie Frampton again?
Thank you very much. Each year the CCG, NHS England require the CCG to go through an assurance audit process. this year our audit was around primary care governance and contracting. The terms of reference for this was brought to a previous PCC and approved, and this is now the final report. So the CCG has performed really very well in this, again, for the second year running, I'm delighted to say, and that there are 2 minor low risk areas for us to consider. One of them is to ensure that each item brought through the contractual issues reporting is referenced with the relevant sections of the policy and guidance manual. So we will make sure as a team that we include those for the committee. The second low risk was around the quality dashboard and the primary care improvement group. So I'm delighted that we've now picked the reinstatement of that group up, and Dr. Gunter Muscular, along with the primary care team and others, will be able to look at that work and make sure that the due diligence is done through that group and then reported back through to QPSC, which is our main quality group for the CCG. So this is just for the committee to note, but I have to say I'm really pleased with this, because this is the highest sort of level that we can get. So for the CCG, I think that reflects well and reflects on our general sort of position as being an outstanding CCG.
Julie, I'm delighted that you're delighted. I'm hoping, and I'm sure I'm right, that the rest of the committee are equally delighted. And as chair of Barnsley Patient Council, I will take this to Patient Council and make sure that I'm equally delighted at that meeting. That it's confirming for the people of Barnsley that we're doing a pretty good job on their behalf. So, any questions for Julie? Okay, thank you. Well done, Julie.
Thank you. Oh, Nick has got a question, Chair.
Sorry.
Yeah, Chris, when you go to the Patient Council, I think that's really good. But if I was a member of the Patient Council, I might say this is the CCG blowing its own trumpet. So it might be a good idea to take with it some of the GP survey information and the actions that arise out of it, because if they look at that, I think they would want to be assured as well what we're doing, and you might get some feedback from them around, and you've probably done this, I think you've done this before, some feedback around access.
Yeah.
Yeah, it just puts the 2 bits together.
Mm-hmm.
So on the one hand, there's something that's come up, we've got an action plan, but on the whole, we're managing very well, excellently. Yeah.
Thank you, Nick. Good point. As you know, I've never been shy in coming forward when we've got good news for the people of Barnsley. And by jolly, over the last 5 or 6 years as I've been around, I've been delighted to deliver fantastic news as to what we're getting up to. So I've never been shy in blowing our trumpet on your behalf, because we've all done a pretty good job. Nick, Jermaine.
Thanks. I was only going to add to that, really, that the 2 knit together quite well, because I think Julie said that the quality dashboard in the quality improvement group is how you'll look to keep a close watch on some of the telephony and access things, and that's what's picked up. So the 2 marry up quite well, don't they, with how you'd build one. One would support the other.
Yeah, definitely.
Okay, so
Thank you.
We're end of the Julie Frampton show. So thank you, Julie. I appreciate you doing an awful lot of work behind the scenes there to put all of these reports together along with your team. So Richard, on to my favourite, and unfortunately it's agenda item 13. It's not unlucky for anybody, it's really lucky. So our risk and governance report, Richard, if you'd like to take us through that.
Yeah, thank you, Chair. So just 3 elements to this report today. There's the assurance framework, the risk register, and then the committee assurance report. So to take the first 2 elements of that, in combination, the assurance framework and the risk register, this is just, for the committee's assurance, we've provided the full extract of this committee's bits of the assurance framework and the corporate risk register. There are not any sort of new or particularly increased risks that we're bringing to the committee's attention this time. So they're just there, as I say, for the committees to be assured that those risks are still being reviewed and updated. And obviously, if there's anything in there that committee feels isn't correctly described or isn't correctly scored, or if there's any other risks that you think we need to reflect on there, obviously this is the opportunity to say so. And I was just going to mention at this point the point that Nick made earlier on under matters arising as well, that that the specific risk in relation to primary care workforce, the wording around that is going to get looked at over the next few weeks, and we'll bring something back to the next committee about that. The final part of my report, as I mentioned, is the Primary Care Commissioning Committee Annual Assurance Report. Those of us who've been in the CCG for a while will remember every committee does one of these each year. It's just the way that the committee reports through to Chris as the accountable officer, and also to the governing body to provide assurance that we've discharged our terms of reference and that we've managed any risks that fall to this committee to manage, really, and also picks out some highlights of the work that we've done over the year. So the draft report that you've got in front of you today is a sort of team effort between Angela, Julie and myself. We think it captures most of what we've done. But it's just there really. We're asking committee to approve that report. If there's anything in it that people don't agree with, or any particular things that we haven't mentioned in there that you feel that we should mention, again, if you speak up now, we can tweak that before it gets finalised. So that was all I was going to say. Chris, it's over to the committee for any comments or questions.
All right, committee. Any questions or comments? Dr. Balash wants to come in on this one again.
Yeah, as chair of the CCG, to have an attendance of 2 out of 6, I think there should just be an asterisk there, an explanatory note explaining that it did clash with another meeting and that we've changed that. So that should facilitate better attendance, please. Yeah. Thank you.
Yeah, we can do that, Nick. That's fine.
Thank you.
Thank you, Nick. Lord Paul Millington was very good at attending meetings, actually. I was hoping that I might get an annual report every year, but it's no. So, Nick, thank you for that. And any further questions for Richard on this? Okay. Before I move on to agenda item 14, which is the conduct of the meeting, I'd like to bring in 1 or 2 people who've been fairly quiet for all sorts of reasons. So, Carrie, I wonder whether there's any little gems that you'd like to share with us as CCG, and bear in mind this is being recorded. The people of Barnsley would also get the opportunity to listen to some of the things that as service director you've been originating, pushing and making sure it happens for the public health of Barnsley.
I suppose, Chair, if I can, I'll just mention the work around the pandemic, because that really has kind of taken over much of public health work for the last 12 months or so, notwithstanding that we really are trying to keep focused on living with COVID, thinking about roadmaps, thinking about lifting of restrictions. And maybe I'll just mention, I know we've just been at the vaccination cell meeting with Julie Frampton just this morning, working really closely with our health colleagues, especially our CCG colleagues, around the really successful vaccination programme in Barnsley. So making sure that public health and the council do our bit to support the NHS-led vaccination programme, particularly around making sure that all parts of our communities and geographies across the borough are able to and do take up that offer when it comes to them, when we get to those cohort groups. So I won't go into much more detail unless anyone's got any questions, but just to say that we continue to work really closely together to make sure that we sort of achieve the best outcomes for Barnsley people, and we'll really be focusing on that kind of recovery and post-pandemic and what that might look like.
Okay, Carrie, thank you for that. Just to assure you that I also attend the South Yorkshire and Bassetlaw lay members meeting, and wherever possible, whilst I always I'm very, very bullish about what we do because I passionately believe in what we do, I also make sure that they are aware of what Julia Burrows and your team and her team are doing in relation to looking after the people of Barnsley. Vital, and it's all about integration as we're moving forward, working together. Dare I say, no boundaries, seamless care, one team. I've got to get that in. So there's one person that I've not really heard from this morning, and I would like to, because I call him our detail man, which is Nigel. Nigel, are you? You must be assured, otherwise you'd have stuck your hand up. But anything that you've heard this morning?
No, I haven't got anything, Chris. That was fine, thank you.
Okay, so one other person is Mike Sims. Any words of gems for us, Mike, this morning?
No, I think just to congratulate Julie and her team on the presentations and the work they're doing in the background.
Thank you.
Well done, thank you, Mike. So on to item 14 then, just to go back on the conduct of the meeting. Thank you for reading all the papers that came to you. I'm making the assumption, which is quite wrong, but I'm making the assumption that the papers came to you in good time and you were able to read through an awful lot of detail there, so thank you. I think as we've gone through, we've assured the committee and whoever looks in from the public, I would hope that we've assured the public that we are getting on with our business on a day-by-day basis and nothing stopping us. So are there any training needs required? Okay. Richard, have we got any questions from the public relevant to this agenda?
No, we haven't, Chris. As you know, just for the minutes, we offer the public the opportunity to submit written questions because obviously they can't attend in person, but we haven't received any for this meeting, no.
Okay, stay with me, Richard, because what I'm looking for now is items that escalate to the governing body. If anybody wants to pick up, what have you noted anything, Richard?
Well, I would probably be highlighting certainly the 360 assurance audit report to governing body as a something that we would want to make something good of. We might want to mention that we've received and reviewed the GP survey, maybe.
Okay. Any more comments? Anything else that we ought to be telling the governing body about? No. Okay. So just to confirm that our next meeting will be on Tuesday, the 27th of May at 9:30. And as we've come to the end of this agenda, it's incumbent on me to read that the representatives of the press and other members of the public be excluded from the remainder of this meeting due to the confidential nature of the business to be transacted. Publicity on which will be prejudicial to the public interest. Section 1, brackets 2, public bodies admission to meetings at 1960. Lots of words, but nevertheless, thank you, everybody. We will now move into our private session. So if you'd like to come out of this meeting, and we'll be back at within about 5 minutes. That's okay with everybody. Thank you.